Hello, my name is Gamaro Sanchez. I am a registered respiratory therapist for URS Medical. What we're going to do is going to show you some demonstration videos on some of the items that we do use here at URS. In general, these videos are a form of resource, and it's how we do most of our general setups. If you do ever have any questions, feel free to give us a call and we'll do what we can to help. So this section will be on suctioning. We will do the home use suctioning. This is for more invasive patients, and then we'll have the portable suctioning, which is also for invasive patients, but mostly for a general sense of suctioning. So for suctioning, there are indications and contraindications. The first part of the indications is the inability to create an efficient cough, visible secretions, and the need to sustain a patent airway. Contraindications, there aren't really any contraindications. If the need for suctioning arises, then we would go ahead and use a suctioning therapy. Okay, for both machines, we would always need a canister, a top, an elbow, a filter, suction tubing, the suction tubing for the secretions to go through, an apparatus to suction, be it the neo-sucker, the yonker, the closed suctioning, or the open suctioning. Okay, so the items we went over, you would first assemble your canister with the top to the canister machine. You would connect your suction tubing to the elbow. The elbow goes to the machine and connects to suction tubing, which then connects to the machine. Once that's assembled, you'll take your suction tubing, you connect it to the actual canister, and whatever suctioning device you'll be using, you would connect that to the end. In this case, it's a yonker. So when you turn it on, the power button's on the side. Make sure that the canister is closed and you check your pressure. If you need to increase the pressure, you return to the right. And it would show an increase in pressure. In adults, you would want a max of 150 millimeters of mercury, and in neonates, you would want from 80 to 100 millimeters of mercury. You want to check your pressure. Places where leaks could happen or you lose pressure is that this tubing is not on correctly, this suction tubing is not on correctly, and the major one is that this cap is off or this gray cap is popped off from the canister itself. So just make sure all your connections are good, and then put your thumb at the end of the tubing to check the suctioning before you apply it to the patient. Okay, so this is the portable one. The same way you would need a canister, an elbow. On the elbow it says bottle, so that would obviously go to the bottle. The filter connects to the elbow. The suction filter tubing connects to the actual machine. Next, you would connect your suction tubing and then the apparatus that you would use to suction. In this case, will be a neo-sucker. You would then turn on the machine and then it would increase the pressure. You would go on the positive side and they would give you your reading. Here we're showing 100. You can connect your apparatus and you're still getting 100. For troubleshooting, you always want to check your connections, because if connections aren't right, you lose pressure and you're not going to generate that negative pressure. So the places you'll be able to lose pressure is at the connection points. So the elbow where the connector connects to the filter, the cap to the canister, or where the tubing connects to the canister. Just make sure all those are connected and then you occlude the end, and if you're still getting a good reading, it means that the machine is working. If you do all that and there's not a good reading, say the elbow's off, and you do it, nothing moves, then you're losing pressure somewhere. So the apparatuses that we can use for the suctioning is the neo sucker, a yonker, an open suction catheter, or a sleeve catheter, or a closed suction catheter that connects to a trach. Again, if you have any questions about the machine, about troubleshooting or supplies, just give us a call and we'll do our best to help you. Thank you.